Welcome to today's New England HIMSS webinar, Learning How to Best Engage with Your State Legislators in 2022. Please send all questions via the Q&A feature and we'll answer them during the session. We're going to begin today with Mary Gryzkowicz, who is our Director of Government Affairs, Federal Policy for Cigna, and also the Chair of New England HIMSS Advocacy Committee and the HIMSS National Public Policy Committee. Welcome, Mary.
Liza, thank you very, very much for all your coordination and all your hard work in helping with this, and the HIMSS New England volunteers. We are thrilled to have you. First of all, I'd like to welcome all of our attendees today and those that may be listening to us in the future. I hail from Madison, Connecticut, so I am truly a New Englander and love all things and all sports New England. I wanted to talk to you a little bit about the Advocacy Committee. It is a voluntary committee, and we are currently open to volunteers for all what we call HIMSS active members in good standing. What the committee does is we really look at issues that are really relevant at a state, from a grassroots perspective, national and global lens on how we can improve the cost effectiveness and quality for patients through information technology in everything that we do. And we do this with our chapter advocates and our wonderful volunteers. With you today, we are going to have an awesome panel, and we're going to talk about some of these issues. We're going to talk about advocacy, how you can get trained and how you can learn how to do some message development, how you can speak to your representatives and get over that fear of having that conversation and bringing those issues forward. So I'm really excited today. Please contact me or please contact the chapter if you're interested in joining us, and we will teach you grassroots advocacy and public policy. With that, I'd like to begin this session by introducing our moderator today. Liddy Balik is really a true New Englander. She's from Southern Maine, and she's been there since 2008. She works as an Epic Applications Analyst for Maine Health, and she's finishing up her health informatics master's degree through the University of New England. So another New Englander for true. She's an active member of HIMSS New England, and she's serving on the Advocacy and Student Advocacy Committee. So with that, I wish you all a wonderful session today. Welcome, Liddy. I turn over the session to you. Thank you, everyone.
Thanks, Mary.
Thanks, Mary.
As a volunteer of the Advocacy Committee, that is an incredible committee to be part of. So if you are a New England HIMSS chapter member and are looking to be more involved or be more directly involved in policy and legislation, then please get in touch with Mary. It is my privilege to introduce our panelists today, and I'm going to start with welcoming Tom Leary. Tom Leary is Vice President, Government Relations for the Healthcare Information and Management System Society, where he leads the organization's public policy initiatives, policy analysis, and outreach to support the vision to realize the full health potential of every human everywhere. Just a small order there. And then also with us today, we have Representative Richard A. Evans, MD, who is serving in his first term in the Maine House. He serves on the Health Coverage, Insurance, and Financial Services Committee. He represents District number 120, which includes the Atkinson, Brownville, Dover-Foxcroft, Lakeview, Medford, Milo, and Orneville Township communities, in addition to some others. Dr. Evans is a decorated veteran of the U.S. Air Force, serving as a hospital commander, AFB-MO, and subsequently appointed as the medical group commander of the 28th Medical Group, Ellsworth AFB-MO. He is self-employed in his solo general surgery private practice as well. We welcome you both. We're so glad to share this time with you today. We know your time is precious. Speaking of time, we know that an hour is short. So here's a bit of a roadmap for the next 45 minutes. We're going to spend about 30 minutes asking questions of each panelist. Tom will give you about 15 minutes, and then Representative Evans, there'll be 15 minutes for you. And then we'll follow up with questions from our audience that are posed in our Q&A, as well as a quick lightning round of questions if time allows. And then our goal is to get everyone on their way by about 10 minutes before the hour, because we know this is a lunch and learn, and most folks, including our panelists, probably have a 1 o'clock meeting to get to. So we want to get you there on time. All right. Tom, we'll start with you. Why are the state elections so important to our grassroots chapter work in health information technology?
Well, first of all, Liddy, thank you. And thank you to the New England HIMSS team for inviting me to be part of this wonderful Lunch and Learn webinar. And it's truly an honor to be a panelist with Representative Evans as a lowercase v veteran of the Pentagon years with the Defense Health Agency, and before that the TRICARE management activity. I know the kind of work that Representative Evans did during his active duty career, and now his decision to bring his medical skills to bear both to the folks of Maine as well as to the policy angles. It's very much a pleasure to be on this panel with you, sir. And specifically, why are state elections so important, and why is grassroots engagement so important? It's that very reason of we as a community, 110,000 strong across the world, but you know, as Tip O'Neill is quoted as saying, all politics is local, and he you know, it's your state representatives, your state senators want to hear what's happening at the local level and how they can impact the community. So why you should get involved is because you are the subject matter experts on healthcare information and management systems who can help Representative Evans and his colleagues, whether it's in Maine or other parts of New England, identify what the latest challenges are and really find practical solutions that'll work for you know, for everyone in the community. So it's absolutely critical to get involved in you know, and have your voice heard, because your subject matter expertise will make for better policy.
All right, thank you.
Sure.
Speaking of politics being local, certainly New England is diverse in its population, in its geography. What did the New England results look like overall?
Well, in 2021, you know, the elections were primarily focused in just a couple areas, but the overall topics, I'd say, that were most of interest to individuals across New England are broadband access, you know, as they relate to our community. Broadband access, you know, and we have worked for many years with making sure that healthcare facilities, libraries, and schools have have access to broadband, because as the pandemic has pointed out, all those three core areas of the community, if you will, require you know, high-speed internet to be able to provide best education for our students, whether they're at virtual learning or you know, doing their homework at home. You know, healthcare facilities need to be able to have broadband access to be able to communicate, you know, in a very much an app economy, an app environment between providers and patients, particularly as you think about some of the rural areas in New England. You know, we've spent a good amount of time in the last few years working with Senator King and at the federal level around the Senate Broadband Access caucus. And you know, as many people think of when they think of New England, they think of Boston, or they think of Hartford or Portland. They don't think of the small little islands off the coast of Maine, or the mountains of New Hampshire and Maine and Vermont. So it's broadband was very much on the minds of voters and on elected officials. Secondly, modernizing and connecting mental health and behavioral health along the same lines as the broadband helps to support that broader access. And then finally, as is played out across the country and across the globe, what to do about vaccines, vaccine mandates, mask mandates. So those are the types of healthcare challenges that are front of mind for voters in this past cycle, as well as what we would expect in the coming year in the next November elections.
Yeah, that actually was going to be my next question, and certainly as you talking about these things, I could see how they're still very much on the agenda for 2022. Are there any other issues you see moving into 2022 that maybe we haven't seen as much in 2020, 2021?
Well, I would say that the last several years have really underlined the need for equity in healthcare, equity across the country, and equity in healthcare. We're 1 week removed from Martin Luther King Day, and I think that what Dr. King talked about, going on close to 60 years ago at this point, is still should be front of mind. And within healthcare, as we've discovered throughout the pandemic, digital health equity is got to be a #1 issue for HIMSS and our membership. So the board of directors this past October, looked at our public policy principles and said, you need to make sure that health equity is #1 and remains #1, because sometimes cybersecurity is more important on any given day than telehealth, or et cetera. But advancing and focusing on the HIMSS vision for better health for every human everywhere is got to be front of mind for us. So as we look at 2022, the maternal health momnibus at the federal level, 2 of the 10 bills were passed at the federal level. There's a bunch of work still to be done there, but at the state level, we've been urging since Global Health Equity Week in October, we've been encouraging states to take up maternal mortality and how health IT can be supportive of maternal health. So I would say that for 2022, you'll see that as a major push for HIMSS. Whether you get along with her or not, everybody has a mother. And if we can all, I get along great with mine. I was born on her just shy of her 30th birthday.
In case she's listening.
In case she's listening. She's a big Bills fan, so she's recovering from Saturday night or Sunday night. Yeah. But if you think about what HIMSS is looking at is how can technology help to address some of what is happening at what's being talked about by the Vice President of the United States, but what's being talked about at the federal and state level. And so what we're hoping advocates can push for in this coming year is more activity in momnibuses at the state level. And Representative Evans, we'd love to engage with you in the main legislature on that as well.
That's actually a wonderful segue into my next question, which is how best can a HIMSS member engage and get involved at the local level on health IT issues? In some ways, it's such a broad category, but on the local level, it may seem very kind of specific and difficult to make a priority on the agenda of local politics. What recommendations do you have?
I think it's evolved over time. When we first started our advocacy work, close to 20 years ago, no one could even spell HIMSS. So now organizations, legislatures across the country, and legislators know the organization, but what they really need to understand is what are the local issues and how can we make policy change that helps people in the community. So if you're an advocate, if you're interested in being an advocate, follow that first slide that we saw from Mary and just at the beginning. Get involved with the committee, and I would say as you're thinking about getting involved, figure out what is your expertise. Are you a technologist who absolutely understands the app economy? Are you a nurse informaticists or a data scientist? Are you, somewhere in between, a clinician that's really passionate about what the good and bad of your EHR and the policy change that could be helpful? Or are you a privacy lawyer who wants to see changes in 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 privacy, in data privacy laws? So identify what your subject matter expertise is, and we all have it, because you remember, not everyone, not every legislator has the background. Like Representative Evans doesn't have a medical background, so you're coming to them with the confidence of your expertise in your field. And I would say that, get involved with committees, but also don't, as Representative Evans, I'm sure, can attest to, we still, state legislators still have to walk their dog and, and buy groceries, et cetera. So they're very much approachable. They particularly if you start out with a, hey, I've got a good idea, and calling, sending, looking on their website, how do you get in contact with them, and whether it's a phone call or an email or answering a survey, those are really the key first steps for getting involved.
Those are all really great ideas, and any one of those is certainly more likely to be within someone's comfort zone than probably what we think off the top of our heads it involves.
Right. No, you don't have to go and give a big speech on the, I know that New England is littered with wonderful, green space for big speeches, and which is wonderful. It dates back to the revolution and pre-revolution, but yeah, you can start with what you're comfortable with, and the keyboard of a computer.
I like what you said too about bringing your own, knowing that you have your own expertise to bring to the table. That's really important. Not only our own voice, but our own expertise. So thank you for that point. I'm going to that one for sure. I have one more formal question for you, our list of questions, and that is, and depending on how you answer it, that may lead to a couple follow-up questions. Sure. So I'll just give you the first part for now, and that is, do you see a move toward a national privacy regulation in 2022?
I see it as a necessity. Whether it will make headway in 2022 is still pretty much up in the air, because if you think back to January of 2020, we were at the Office of the National Coordinator's national meeting, literally 2 years ago this week, and we were announcing the Global Consortium for eHealth Interoperability, and every sidebar conversation was the upcoming data privacy law that was going to be introduced, or the legislation that was going to be introduced at the Energy and Commerce Committee in the House of Representatives. Fast forward 6 weeks, and we've got the pandemic starting, and data privacy still very important, but is seen as a back burner issue until we get through this national and international public health emergency. So as we, if the Omicron spike and drop off does truly lead to an end to the public health emergency, I could see us getting further along on a national discussion around data privacy, not just in healthcare, but across the board. Will we get something done in 2022? The closer you get to July and August, the harder that will be, because we've got midterm elections, and both parties really want to, one party wants to keep the House and the Senate, and the other party wants to gain the House and the Senate. So major legislation in an election year, a national election year, really goes into pause mode right around 4th of July or just afterwards. So if the public health emergency is not over by that point, I would say we'd have to expect privacy legal change in 2023. That doesn't preclude the Biden administration from updating the HIPAA regulation that was first promulgated by the Trump administration. And, you know, former Deputy Secretary of Health and Human Services, Eric Hargan, who was in the Trump administration, deserves a lot of credit for starting the national dialogue around reforming HIPAA. And the Biden administration, when they came in, they deserve a lot of credit for saying, let's not shelve this, let's pull it back, let's bring it back out for additional public comment based on our priorities. And now let's continue the national dialogue. I would fully expect a HIPAA regulation out by summertime, but in terms of an overall data privacy legislation, that one's going to be harder.
Okay, yeah, certainly timing really is a factor in all things, isn't it? There's
absolutely
what we plan and then the universe happens. Representative Dr. Evans, I want to lead with all of your titles all at once because you have such a distinguished background and level of service to our country. Thank you so much for your service, both as a person in the armed services, but also your service as a physician and a healer. So as a prominent physician and U.S. veteran, this is your first term as a state representative in Maine. What made you decide to run for office?
Well, thank you, Liddy. That's an interesting question. But before I start, I'm going to have to track you down here in Maine and get to talk to you. And to Tom, I agree with everything you just said. And before I make my final comments to your question, I want to thank Dr. Joe Heyman, who informed me of this organization. And I'm surprised that I had not been aware of it in the past, because obviously, as I looked at the history, there's been a lot of great work done by this organization. So to get to your question, why did I decide to run? I think that as a physician, there's a tendency and a sense of purpose to be willing to put others before yourself. This sense of purpose goes back, I think, in my situation, to my childhood and the examples that were set by my parents. I grew up in an impoverished neighborhood in Houston, Texas, of all places. But despite this disadvantage, my parents always kept us focused on the concept that no matter how immediate our circumstances were, there were many other people in our neighborhood who were in worse situations. So I was surrounded by families who held low-paying jobs. And in every situation, these same families had no health care. As I fast forward to today, I see so many in my local and surrounding communities who exist under the same conditions as my family did way back then. A lack of jobs, poor wages, and no health insurance for themselves or their families. Having walked in their shoes, I know how demoralizing these situations can be for individuals and for families. And I see patients in my office, just like all other physicians in New England and across the nation, who are desperate and embarrassed and require medical and surgical attention. However, they can't get that attention or had not gotten that attention because they just simply lacked health coverage. Even worse, I think, is that these same individuals' families had no one to advocate on their behalf. So that is the number one thing I think that's poked me towards running. The other thing is that politically, one party has held the district that I now represent for 30 years. And not after 30 years, I would expect to have seen some improvement, but we haven't seen that improvement. I still see the need for a vocal voice and an advocate for the people in these rural communities in particular. And the other thing that kind of bothers me is the fact that our younger physicians are needing guidance in the respect that they have no way of advocating for themselves, especially if they're employed through large systems. And there's lack of direct input and lack of decisions regarding the value of these physicians and their needs and desires. So not just advocacy for patients, I want to be an advocate for our younger physicians to allow them to practice medicine in the fields that they chose.
This is not the first time I've heard of this, where medical students are being steered in one direction or another because of the competition for residencies and so forth, and even some inequities regarding race and which kind of residencies and specialties you can go into or are likely to be accepted into based upon your background. So certainly I can hear that in your voice, your passion for advocacy. Would you describe advocacy as basically intentionally choosing to be in the problem solution side of an equation versus just a sideline and a complaining side?
No, I see it as the direct involvement because there is a problem. And until the problem is recognized and solutions offered, then we're going to continue to repeat the cycle over and over again. So I see patients needing advocacy. I see our younger physicians needing advocacy. I don't like to see people go through so many years of training and not be able to practice the trade that they work so hard to get. So we see this at the American Medical Association. I've been Maine's senior delegate now for about 20 years. And one of the things that we wanted to do is to focus on our younger physicians and to get them more involved in not just the medical aspect of it, but the political side as well. Just in my time in the legislature, fortunately for Maine, we have 5 physicians in our legislature. At the end of this term, we'll be down to 3, but some states don't have any physicians. But you have people making decisions, healthcare decisions that should have involvement from physicians or other medical specialties, specialists, but that input is lacking in far too many cases. So I see that as an area that needs to be improved.
Okay. And it sounds like in many ways you've already addressed my next question for you, which was to say what hopes for accomplishments will be for your time in office. Did you have anything more specific you wanted to say about that?
Yeah, I think so, because at this point in my career, it's not a matter of whether or not I'm going to be reelected. That's not why you should run. I think that you need, if you're going to be there, you need to be there for a purpose. The hardest thing that I've had to adjust to has been a commitment to use of time. Being in the military, I'm a stickler for something is, the meeting is supposed to start at 8 o'clock, the meeting starts at 8 o'clock. In the legislature, 8 o'clock means somewhere around 10:30. That doesn't work for me too well. But I have had 2 primary areas of interest since I entered the legislature. And as we mentioned earlier, I serve on the Health Coverage, Insurance, and Financial Services Committee. And during our first session, we passed a bill called an act to lower healthcare costs through the establishment of the Office of Affordable Healthcare. And that was introduced by our Senate President. That bill went into law without the governor's signature. So that made me introduce a bill of 1778, an act to improve healthcare affordability and increase options for comprehensive coverage for individuals and small businesses in Maine. And my bill just had a hearing, public hearing last week and was voted out of committee. The Senate President introduced the first bill that I mentioned, and he is a co-sponsor of my bill. So and the other thing is that I did get a communication from the governor that she was in support of the bill. So I see no reason why this bill would not be enacted into law. As a matter of fact, we meet at the legislature tomorrow to vote on bills. But having said that, I think sometimes people will introduce bills or not introduce the bill because of a possibility of a veto. I think that's a big mistake. If you have something that you think is going to be a benefit to more people, then as a separate branch of government, you have a responsibility as a part of your job to go ahead and introduce that bill. If the governor decides to veto the bill, introduce it again. So.
All right, very good. Thank you. Thank you. You mentioned that you are a new to the organization of HIMSS, and I do have an ancillary provider friend who knows I'm involved with HIMSS, but she can never remember the name and sometimes refers to it as hers. So I know we have some public relations and some communication. We have to get the word out. So you're not alone. But how do you think our HIMSS members can best engage with you and your fellow legislators in this year? How do you, I know Tom has already shared some wonderful ideas. Have anything to add to what Tom did about best ways to engage?
Yeah, I think he hit the nail right on the head. And it's very important to engage in the political arena. And I won't just limit it to the state legislature. I think that the engagement should start at your municipal level, at your school boards or select board members, if you have those in your areas. But because that's where the rubber meets the road. But it's very important to have representation in the legislature. What I find, and I'm sure some people don't realize, is that legislators don't have an actual staff. We have an aide. Sometimes that aide is serving 2 or 3 other legislators. But I encourage people to sign up to testify at hearings. You can go to the legislative website, and every committee is listed, and it has a listing as well for bills that are going to be coming up before that committee, hearing dates, work sessions. So sign up for all of those. Communicating with your legislator with email is one way to do it. I don't encourage you to do that. And the simple reason is that your legislative email is a public domain, in the public domain. So you can get email from anywhere, across the country or even out of the country. So your legislative email mailbox tends to get full really fast. What I've found is that when people do communicate by email, they oftentimes forget to put a phone number on. Mm-hmm. If you put a phone number on, you are more than likely to get a call back directly from the legislator than not. The other thing is when we're in session, you can make a call to the Senate office or the House office. You can leave a message, and that message will be delivered to the legislator, even if you're in session. So, but don't be afraid to engage and ask the questions. And always, if you have a concern, bring it forward. It's probably going to be something that the legislator is not aware of. But I would strongly caution anyone who communicates to not make demands. That's what I usually see mostly in my legislative email, and the demands are usually from people who are not even in your district. So, but that communication is of value. And finally, texting your legislator is also an effective way to communicate.
I'm appreciating this as a health IT person, hearing a physician and a military commander and legislator share what forms of communication are the most effective for your. So thank you for that. And I feel like you dropped some inside knowledge. I never would have guessed that phone would be the way to go.
I was writing that down.
So if you want to put your phone number in the chat, no, I'm just teasing. No, seriously, thank you though. That's another nugget to take away from this conference, that as much as we think email is the least intrusive, in some ways it sounds like it's the most intrusive because it's rather anonymous. You're not sure where it's coming from. And maybe it's easier to just make those demands versus starting a fruitful conversation. So
the other thing about that is you get into a back and forth. I answer, you answer. I answer, you answer. You pick up the phone, we talk about it in one conversation, and it's done.
Mm-hmm.
Very
Oops.
True.
Did
Just as use
No, you're
teach
still there.
all of your, pardon?
Hang on. Can you hear me?
Uh-huh.
Let me, I just lost my screen.
Don't go anywhere.
We can still see you.
Oh, there, okay. That happens quite a bit.
Actually, that's a fun segue to my next question, and that is what kind of health IT do you think would be helpful for your constituents, both as and you bring that perspective again as not only as a legislator and a citizen of Maine, but also as a physician. What kind of health IT? I know Tom mentioned the broadband challenge, and certainly Maine has had its challenges and made some headway with that. But what other health IT do you see as crucial for Maine and its constituents, especially where you serve?
In this area in particular, in northern Maine, northern central Maine, broadband is the biggest issue. If you have too strong of a wind, you can lose your connection. Infrastructure for rural hospitals, the actual human resources to manage that technology. We don't have access to a lot of those types of individuals. And that's one of the things that we've been trying to stress as career opportunities through the University of Maine systems to promote more entry into computer-based programs. In some of the local area high schools, they're starting to focus more on that. But then the other factor is cost associated with. Those are things that we know there, but the need and the value of IT is showing itself to be real, and it's something that we obviously will have to go ahead and make that investment in.
Thank you for that. That concludes our individual questions. So we have just a couple lightning round questions for both of you. So feel free to jump in, whoever wants to speak first. Kind of piggybacking off of that question about broadband, let's talk a little bit about telehealth. Do either of you see a need for additional legislation relating to the extended use of telehealth, both during the pandemic and afterward?
Go ahead, sir.
Okay, well, yes. Telehealth, we actually have had that it was in place even before the pandemic, but the pandemic has shown that we need to make a major investment in telehealth. Now, the interesting thing is that in the first session of the legislature, I think we had something like 5 bills that were introduced. None of those bills were passed. And that was somewhat of a disappointment, but there was a lot of nuances that needed to be corrected before we created further problems. So I expect to see more bills introduced from lessons learned during this past session. And I cannot see us going forward without telehealth being a permanent fixture in healthcare.
Thank you. Tom, did you have any?
Yeah, absolutely. At the start of the pandemic, Congress, as part of the CARES Act, provided a waiver for the Secretary of Health and Human Services to extend telehealth services beyond just the very narrow geography of Hawaii and in Alaska, and very underserved communities, to expand it across the entire country, and expanded the types of providers that could use telehealth services. That waiver will come to an end when the public health emergency is declared over, and the Biden administration has said that they'll give a 60-day warning that the public health emergency waivers will be lifted with 60 days from X date. But what we found over the last 2 years is that patients use it for improved access. Providers are using it for better efficiency of their practice. My gastro doctor just in the last 6 months said, "Hey, let's just jump on a telehealth visit." It took 10 minutes. I didn't have to mask up and drive over 20 minutes to get to his facility, et cetera. It took us 10 minutes to get through the dialogue, and we determined that based on family history, I needed to do a few additional tests, but so that's obviously in person, but being able to improve the efficiency of care and keeping it beyond the pandemic is going to be a challenge because of the perceived cost, not cost avoidance or keeping costs down that many telehealth supporters believe are available. What we do have is 2 years worth of Medicare data, though, that will help with the Congressional Budget Office, who has been very reluctant to give the go-ahead or the green light to Congress to expand telehealth for Medicare, which will in turn help insurance companies. I will say that as Representative Evans points out, many states have had telehealth services for Medicaid patients for many years. So the idea of going backward or removing some of those telehealth services, we're very much opposed to. The other thing that we think is going to be a big debate when push comes to shove is do you get same level of reimbursement for audio and video, or is audio only a different level of reimbursement, or is in-person different than telehealth after the pandemic is over? Those are going to be important conversations to have, and I think that given the amount of fiscal responsibility that's, that Representative Evans and others on the committees that across the country that he's part of, that's going to be a big conversation for the country. And then finally, just expanding the provider types in geographic locations has got to happen. We can't go backwards in order to get back to where we are to then move forward again.
Yeah.
Thank you.
Thank you. Thank you both very much. And we have about 5 minutes left, and I definitely wanted to make sure that each of you had the opportunity to make a closing statement on the look ahead and your hopes for 2022. Tom, would you like to go first on this one?
Sure. I would say, given the what the topic of this conversation is advocating, I would love to hear from the New England chapter that your advocacy committee is teaming with individuals who are leaning forward and wanting to provide their expertise into public policy engagement. So and to be a beacon of example, if you will, for the other HIMSS chapters across the country and the communities across the globe. And from a policy perspective, I first of all hope that we're able to get beyond this pandemic and the public health emergency, and that we institute policy changes, whether it's on telehealth side or remote patient monitoring, or most specifically digital health equity, that can keep our momentum of making sure there's proper access, equal access to care. And finally, value-based care has been a part of the conversation in the United States for many years, and really 2015, when the Obama administration started moving Medicare in that direction. With the Trump administration kept it moving, and the Biden administration, I will expect to see a lot of new activity around value-based care there. The rest of the world is seeing that the value of having a conversation around value-based care, and they're asking, they want to learn from Americans. So be on the lookout for some activities within HIMSS on value-based care. And can't drop off without saying, hey, we hope to see you at HIMSS 22 in March. And we got a lot of exciting things happening at HIMSS 22 in Orlando. So I'll leave it at that, and look forward to the representative's final comments.
Thank you.
Well, thank you,
Representative
Tom.
Evans?
Thank you, Tom. I could not agree with you more. The issue, I mentioned that we had, I think, about 5 bills that related to telehealth, and the bills did not proceed for the reasons that you mentioned earlier. Having to do with, is it voice, is it video? We have to come up with a definitive definition that we all can use. And then value-based reimbursement, I think that's going to be critical going forward. But my hope is that we have learned something during this pandemic, and take the positives from that and be able to go forward and move things, because healthcare is changing, and it's going to continue to change with each new day. Just to leave it on a final note, it is critical that you communicate with your legislators, and no idea is an unimportant idea. I always take the position that if you can think about it, then there is potential that you can do something about it, because 9 times out of 10, that is something of value, and you've thought about it, and others need to hear about it, and that's how we progress. So talk to your legislators. I think that everybody, especially physicians, I hope that physicians stand up and don't be discouraged. The only thing that you have to lose is the race, but you can always run again. And I know that that's hard in some situations, depending on your level of experience, where your specialty, where you are in your career. But stay involved and keep speaking out. So I thank you very much for inviting me to participate in this conference. And Tom, thank you. And Liddy, we'll be talking.
Okay, thank you both so much for your time. We know legislature is in session, and you've got squirrely weather. Welcome to Maine. And we know that Tom has a 1 o'clock meeting and is just back-to-back meetings all the time. So thank you both so much for your time and your expertise. I know that it was valuable to us. We really appreciate it. And to our audience, thank you for joining us. Your time is precious as well. Speaking of which, if you are interested in joining our advocacy committee, it will be time well spent. Please reach out to Mary. And I'm going to turn things over to Eliza to close us out.
Thanks, Liddy. Thanks,
Well-
Representative Evans.
Thank you.
Yes, thank you everyone for joining us today. And there is in the survey following the exit today of Zoom, you can very simply put in your email address for Mary to reach out to you if you are interested in becoming a member of the advocacy committee, along with any interest that you have in efforts that you want them to know more about. We have entered that question as well. So just thanking everyone for joining us today, and this will be posted on our YouTube HIMSS channel if you'd like to review it again, if you missed any of the good points that they came across today. We appreciate your time. Thank you so much.
Thank you. Bye-bye.
Bye-bye. Thank you.
Bye.
Stay safe.